Hi, my name is Hunter, and this is my project proposal for the role of diabetes self-management education on glycemic control in people with type 2 diabetes. Diabetes affects around 29.1 million people in the United States and is the seventh leading cause of death. According to Healthy People 2020, about 28% of Americans with diabetes are undiagnosed, and about 86 million Americans have glucose levels that greatly increase their risk of developing type 2 diabetes in the next several years. Financial costs of diabetes in 2012 was $245 billion, and that includes costs of medical care, disability, and premature deaths. The theory that I used for this project proposal was the self-care of chronic illness theory created by Riegel, Jarzma, and Stromberg in 2012. Its key concepts are self-care maintenance, self-care management, and self-care monitoring. And you can see the poster for additional information on this theory. A Level 1 systematic review created by Shervala, Schur, and Littman in 2015 consisted of 120 randomized controlled trials. Its aim was to determine the effect of a DSME program on the change in hemoglobin A1C levels. Findings revealed that DSME resulted in lower hemoglobin A1C results after a median duration of 6 months and greater than 10 contact hours. This yielded a p-value of 0.04. A Level 2 double-blind randomized controlled trial was also analyzed. This was done by Suruku et al. In 2017. It consisted of 139 patients recruited from a diabetes education center at the University Hospital in Izmir, Turkey. Findings revealed that self-care behaviors were increased with a p-value of 0.001, and hemoglobin A1C levels were decreased with a p-value of 0.016. The intervention group saw hemoglobin A1C levels that decreased to 7.47% from 7.85%, which was statistically significant. And last but not least, a Level 6 qualitative study that was embedded in a randomized controlled trial was analyzed. This was done by Crow et al. In 2017. Its aim was to explore the experiences of diagnosis and education for people living with type 2 diabetes who have suboptimal glycemic control. Most participants reported experiencing shock when they were first hearing of their diagnosis and found it to be a moral indictment on their lifestyle. Almost all of the participants had no knowledge of the potential physical impacts of the disease and downplayed their diagnosis as a mild form of diabetes. They also reported that their general practitioners had played a main role in minimizing the seriousness of their illness and had provided them with very little information. Based on all these findings, a project was proposed to implement the intervention in professional practice. We will begin by obtaining IRB approval. We will establish a treatment team of doctors, APRNs, RNs, and a diabetes educator. We will screen all newly diagnosed patients and those who have an existing diagnosis but display uncontrolled glycemic control. Screening will use the Diabetes Self-Management Questionnaire, or the DSMQ, and you can see the poster for a copy of the DSMQ. We will obtain written consent from all participants. All participants will obtain an initial fasting plasma glucose level along with a hemoglobin A1C level. Patients will be enrolled in a 4-week DSME program led by the diabetes educator, and weekly meetings will last approximately an hour and a half. Bi-weekly meetings between the multidisciplinary team will happen for the first 3 months of implementation to discuss strengths, weaknesses, and needs for the program. Monthly meetings will follow after the first 3 months. The DSMQ will be completed again at a 3-month follow-up and a 6-month follow-up. Fasting plasma glucose levels and hemoglobin A1C will be drawn again at the 6-month follow-up. And the multidisciplinary team will evaluate the need for further education and re-enrollment based on results of the DSMQ screening tool and results of the FASTA plasma glucose levels and hemoglobin A1Cs. A Gantt chart is displayed in the project poster as a timeline for my interventions. And all outcomes will be measured using the DSMQ tool and follow up fasting plasma glucose levels and hemoglobin A1C. Please see the references section of the poster for all websites, articles, and tools used for this project proposal. Thanks, and I hope you've enjoyed this presentation.